What are the key findings of the EASL Lancet Commission on Alcohol and Liver Disease?
So the findings essentially were that, firstly, the Europeans drink more than anyone else, and around 60 to 80% of liver deaths in the European region are alcohol-related, they're due to alcohol. Liver disease kills young people. The average age of death for liver disease is around about 50. And in terms of years of working life lost, only ischemic heart disease causes more years of working life lost in Europe compared with liver disease. If you walk around my liver wards as they were in the UK, they're full of people in middle age and late working age. And most of the other wards in the hospital are full of people in their 70s, 80s and 90s. Liver disease develops without any signs or symptoms, and so it's diagnosed late. It's usually diagnosed when people present with an acute complication, either variceal bleeding or acute on chronic liver failure. And we estimate that 75% of people who are currently alive but who will die of cirrhosis are unaware that they have liver disease. So there's a major issue with finding people with asymptomatic liver disease and indeed cirrhosis. And one of the key problems that we found throughout Europe is that primary care in liver disease is completely undeveloped. Very few GPs are confident about liver disease, and that's a major disadvantage when it comes to picking up liver disease earlier. Compare the management of liver disease to that of diabetes in primary care as chalk and cheese. We found that stigma is a major issue. There's stigmatization against liver disease, patients with liver disease, the stigmatization due to the risk factors, which are alcohol predominantly and obesity, 90% of mortality. And stigma is a major issue in terms of political impediments to developing effective alcohol policies. And that's a great shame because liver disease can be prevented. And if we were more effective in preventing liver disease, then potentially we could prevent around about 300,000 deaths each year in Europe.
How can cirrhosis complications be prevented?
Some basic principles about liver disease, which I think are important in understanding the response to that question. The first thing is that complications tend to be acute on chronic events. Now, acute on chronic liver failure, acute variceal bleeding, so there's a background of chronic liver disease, and then something acute happens. And a lot of the mortality from alcohol-related liver disease are due to those acute events. And those events are dependent entirely on your recent drinking behaviour. So as soon as you stop drinking, then your prognosis, your projected survival starts to improve. So in other words, people are dying from alcohol-related liver disease. They might have had cirrhosis for 10 years or longer, but they're dying from the acute complications of their recent drinking. And then the second important principle is that the dose response between alcohol and liver disease is exponential, and that's very different from other alcohol-related diseases.
How can health professionals help advocate for alcohol policy changes?
The answer to that is very straightforward, and it's potentially something which is very effective. So the first thing you can do is read the EASL Lancet Commission paper, which will tell you all about the problems and all about the solutions. And then the second thing you can do is to invite your local MP to visit your liver unit. And I've done this on a few occasions now. And if you do it and you can get a journalist from your local paper to come along as well, then you get twice the result and your MP is more likely to want to visit. You obviously have to speak to the staff and patients and make sure that they're happy to speak to politicians or journalists, but on the whole, many of them will be. And you can tour your unit, you can show them your patients, they can talk to patients with cirrhosis, the majority of whom will be very heavy daily drinkers, and you can explain to them what you've discovered from reading the EASL Lancet paper, that the evidence shows that the best way to reduce mortality from alcohol-related liver disease is to target the price of cheap, strong alcohol, and the most effective and cost-effective way to do that is to set a minimum price threshold, and we suggest in the Commission paper a threshold of €1 per unit of alcohol, per 10 mils of alcohol.
What is Eurocare and what is its mission?
We have 52 members across the European region. So it goes from Georgia to Sweden to Portugal to Ukraine. Our vision is a world free from alcohol-related harm. So what we do is that we work with policymakers to ensure that alcohol-related harm receives adequate political attention at EU level.
Eurocare recently published a position paper on alcohol labelling and health warnings. What are they, and why is it important?
I'm going to break it into two different categories. And the first one will be about alcohol labeling, and the second will be about alcohol health warnings. But what's really extraordinary and shocking about alcohol labeling is that, unlike any other product on the market, alcoholic beverages are the only product that don't have an alcohol that don't have a label. In fact, what I've done is I have prepared a little prop, so I will tell you exactly what I mean. And basically, this exemption is true for alcoholic beverages who have a percentage above 1.2%. Sorry, and so products that have content below 1.2%, all beverages, even a bottle of wine which is 0.7%, let's say, they have to have this label. So here is a bottle. It has actually says 0%, and what it has at the back is what is called an alcohol labeling, and basically it tells what's inside, the number of calories, the level of sugar, as well as, other things that producers put on these bottles. And we've been campaigning for a number of years simply to ensure that consumers across Europe, when they buy an alcoholic beverages, can actually know what's on their product. And this has been blocked and is strongly opposed by the alcohol industry, who say that it is too complicated, that it will ruin the market. Myths, basically. It's silly because they're doing it for every single organization in the world who produce food has been able to do it, or beverages, milk, Coca-Cola, you name it. But for some reason, citizens don't know what's happening. They are not informed, and that is not acceptable. This has got to stop, and this is what the campaign is about. And it's about what's explained in our position paper that I invite you to read.
What barriers do we face in implementing alcohol labelling and health warnings across the EU, and what is being done about it?
You're all aware of the warnings that are on the packet of tobacco, cigarettes, which inform the public about various dangers, such as tobacco causes cancer. Well, alcohol is the number one carcinogenic, exactly like tobacco. And what we need to do is to inform the public about the dangers and the link between alcohol and various kinds of cancer, including liver cancer. And again, what needs to happen is, very similarly to tobacco, the European Commission needs to develop a library so that countries that want to introduce health warnings on alcoholic products can come and pick pictures based on the latest scientific evidence. Another thing that, and that is, of course, everything that we do that is to help citizens and patients and people. Level of awareness of alcohol is strongly opposed by the alcohol industry, who themselves dispute the science and say that, drinking alcohol is not an issue. And we all know that it is a lie. An interesting development has happened this year. Ireland is the first country in the world who has introduced a health warning on their product. They did that, so they are heroes of the world. They were the first country in the world to introduce a smoke-free ban. And although we can't see yet these health warnings on the alcoholic beverages, it will be introduced, I think, in 3 years' time. And I think it's a great, great development. Regarding health warnings, it's a measure that is really, really, really necessary. And the reason why it's necessary is that almost no one in the public and out there, including policymakers, but the people don't know that alcohol is the number one carcinogenic, just like tobacco. And to give you an element of comparison, which has been really published, it's a science that has been published. In a bottle of wine, a normal bottle of wine, this one is 0%, but let's say 12% or 13%, there is the equivalent of 5 cigarettes for men and 10 cigarettes for women. So if a woman drinks a bottle of wine a day, which is far too much, but let's say over a week, then that's the equivalent of that person smoking 10 cigarettes within that bottle. And that's because of the link between alcohol and breast cancer. So that's the reason why we need health warnings, because the people do not know and they need to make an informed choice when they consume alcohol.